We, we are here because January is Radon Awareness Month, and our coalition is working to educate residents across Missouri on the dangers of radon and what you can do to protect yourself from exposure. So I will be the presenter and the panel moderator for tonight's presentation. And actually, as a thank you for your attendance, all attendees will be able to receive a free radon test kit. And in order to receive your free radon test kit, you'll need to visit the Missouri Department of Health and Senior Services free radon test kit link. And we will be sharing that at the end of the presentation, as well as in a follow-up email. So I definitely encourage everyone to check that out. So just a few introductions as we're getting started. As I said, my name is Sarah Chavez. I am here on behalf of the Missouri Cancer Consortium, but I'm also the Assistant Director of Community Outreach and Engagement with Siteman Cancer Center. Our panelists today are Chad Robinson from Building Performance Company, Dr. Bandiri from the University of Missouri Healthcare, Jackie Nixon from Citizens for Radioactive Radon Reduction, and Heidi Noffman-Onda with the White Ribbon Project. We're going to begin by covering some basic information about radon. And following the radon overview, we will be having a panel moderated discussion. And that's when we'll conclude with a brief Q&A session where you can ask questions to the panelists if there's any remaining questions that we have time for. If we don't get to your questions during the program, we will follow up with you via email to provide answers. So first off, what is radon? Radon is a radioactive carcinogen, and that basically means that we have enough data to conclude that it has the ability to cause cancer. It's colorless, it's tasteless, it's odorless, it's a gas. And when it's inhaled, the radon particles become trapped in your lungs. So over time, that creates damage to the lung tissue and ultimately alters the DNA of the cells. What many people don't know is that radon is the leading cause of lung cancer in non-smokers and the second leading cause of lung cancer overall. Radon-related lung cancer deaths are actually responsible for radon-related lung cancer is actually responsible for over 21,000 deaths annually here in the US, and prolonged radon exposure poses a particularly serious health concern. So first off, what is radon? Radon is a naturally occurring gas. It's part of the byproduct of radioactive decay of uranium, which is found in rocks and soils throughout the world. So as the radon escapes from the ground, it gets emitted into the air. And that's ultimately how it enters either new homes or old homes through cracks and openings in the floors and the walls. And ultimately, it has the potential to accumulate at very high levels. Ultimately, your probability or your risk of developing lung cancer is going to be proportional to how high the level of radon is and the duration from which you're exposed to radon. So really, that's ultimately what we're looking at is the amount of concentration combined with the duration of the exposure. Exposure to limited concentrations, like those that you would experience outdoors, that's impossible to avoid. But when the radon is getting trapped indoors, it can exist at very dangerous concentrations. And a lot of people think that it's only old homes that have issues, but new homes that are sealed up really, really tightly can actually trap radon even more. So we know that radon is a cause of lung cancer. Radon is in fact so dangerous that the Surgeon General issued a warning similar to the warnings that you see placed on cigarettes. The American Lung Association, the American Medical Association, the American Association of Radon Scientists and Technologists, or ARST, and the Environmental Protection Agency all advise and agree that elevated radon levels should be lowered. But the problem is that most Americans are generally aware of the dangers of cigarette smoking, but are largely unaware of the link between radon and lung cancer. And that's ultimately the goal of the presentations this month. The Goal of radon levels is to get it to the lowest level possible. So when you receive your radon testing, the results are measured in picocuries per liter of air. The EPA recommends taking action to reduce your radon if the result winds up being 4.0 picocuries per liter or more. And you should consider similar actions if your radon level falls between a 2 and a 4. According to the World Health Organization, they actually have a lower limit. So they recommend action anywhere above a 2.7. And to give you some perspective, the average outdoor air concentration for radon is 0.4. So 4.0 represents a very large 10-time elevation over outdoor air. So we know lung cancer is the leading cause of death here in the US, and it claims as many lives each year as breast, prostate, and pancreatic cancers combined. In 2023, we estimate that there would be 238,000 new cases and 127,000 people would die from lung cancer. So we don't currently have the estimates for 2024, but we're estimating it's going to be pretty similar to what we're seeing for the 2023 data. And what that means is that 1 in 16 people will be diagnosed with lung cancer throughout their lifetime. It's actually slightly higher in men than in women, too. But people who never smoke are actually 20% of all lung cancer diagnoses every year. So 1 in 5 lung cancer patients were non-smokers. So if the individuals who are diagnosed at an early stage are that represents about 25 or 20% of all lung cancer cases. That's when it's the most treatable. The overall 5-year survival rate, if it's localized, is 62.8%. But half of new cases are diagnosed when the cancer has actually already metastasized, and that's when the 5-year survival rate goes quite lower at 8.2%. So in addition to knowing the risk factors for lung cancer, it's also very important to know if you are a candidate for lung cancer screening. So according to the USPS task force here, the adults who are ages 50 to 80 who have a 20 pack per year smoking history and are currently smoking or have quit within the past 15 years are the individuals who should be eligible for screening for lung cancer. And they actually do that using low dose CT scans that you can get annually. They have been a game changer for identifying cancer early and providing an excellent prognosis for individuals if we can catch lung cancer early. In terms of the link between radon and lung cancer, we know that radon level of 4.0 is comparable to actually smoking 8 cigarettes a day or 100 x-rays per year. That's a lot of radiation exposure, and we don't really think about it like that. A radon level of 10, which has been seen in Missouri homes, is comparable to smoking a pack of cigarettes a day and 500 x-rays per year. So the major challenge, though, is that when you combine radon exposure with smoking, that actually increases your risk of developing lung cancer tenfold. So the effects are cumulative. And the highest level that we have noticed for radon detection here in Missouri was 474 picocuries per liter, which is actually the equivalent of smoking over 40 packs of cigarette a day. So there's a very strong link between the amount of exposure and the level of exposure and your ultimate lung cancer risk. So radon is found at elevated levels in homes across the US. 1 in 15 homes have high radon levels. And actually here in Missouri, 1 in 3 homes have elevated radon levels. There are over 5,400 new lung cancer cases every year here in Missouri. And so we actually rank 6th in the nation for new cases. If your home has elevated levels of radon, that doesn't necessarily mean that your neighbors' homes are also affected. They may or may not be affected. It's very individualized. So the only way to truly know your home's radon level is to test. Every home should be tested for radon, and radon has been found at elevated levels in homes in every state. So really, it can impact anyone. That's the main thing we want you to take away from today's presentation. The age, the location, the type of home, or the foundation are not determinants for whether or not a building has radon. And testing is currently the only way to truly know if your home has high levels of radon, and their recommendation is to test every 2 years. Ultimately, you're not going to have any symptoms of elevated radon until you start developing symptoms of lung cancer, which again can be quite limited until later stages of lung cancer. So testing is going to give you that head start and that ability to combat the carcinogen before you develop lung cancer. There are some different testing options. So first off, you can hire a certified radon professional. We are actually working closely with the Missouri Lung Cancer Coalition to encourage more more of an emphasis on that certification process here in Missouri. We want to make sure that the individual who you hire to test and to mitigate radon in your home has undergone certain licensures and certain trainings. So all participants of today's virtual program will actually have the ability to receive their own free at-home test kit. You can scan this QR code here, and we will also pop the link in the chat where you can actually go to the Missouri DHSS website and the American Lung Association to order your kit. It's extremely affordable though. Even if you have not ordered your kit, the average cost of a radon test is between $100 and $200. So as we're gearing up for our speakers, we thought it would be helpful to explain what exactly radon test entails. So the only way to detect a buildup of radon in your house is to test the air. And the various do-it-yourself test kits and the digital detectors are actually pretty simple to use, and they are inexpensive. You can hire a professional, and the best way to find a certified professional is to contact your state's radon program. There's also an interactive map that the EPA provides that has contact information for state radon agencies. But here today, you should be able to either scan our code or go to our website, and that will send you directly there. There are actually different types of tests. The two main classifications are passive versus active, and then you can also have a short-term versus a long-term test. So a passive test is actually not going to require power in order to function. The active tests do, so they will require a power source. A passive test usually includes an alpha track detector, a charcoal canister, and charcoal liquid scintillation detectors. So the active test will actually include some sort of a continuous monitor because it does have that electrical component. The short-term tests are typically going to take between 2 and 7 days. Sometimes they can take a few weeks for accurate results. The long-term tests, though, those tend to be actually more accurate because they collect more data over a longer period of time. In those cases, they can take at least 3 months, and they'll measure your long-term averages over that time. But if you don't want to wait for long-term tests, those short-term tests can indicate whether or not your home has a problem and requires follow-up testing. So where do you test and how do you test? During the time that you're going to be setting up your radon test, place the kit in a location where it's not going to be disturbed, in the lowest level regularly used in your home. You'll follow the test directions and other official guidance to prevent problems that can affect the testing. If you opt for the digital detector, those can be purchased for your home and can provide short-term readings and also help you establish an average for that long-term. Testing anytime during the year is fine, but testing during these winter months actually yields the most accurate tests because your home is closed up and the windows aren't open, especially right now. So how do you protect yourself from radon? This is where installation of mitigation systems into homes really can help you with eliminating that danger. If you have an existing home with elevated radon levels, you can have the radon mitigation system installed, and that consists of a vent pipe, a fan, and the proper sealing of cracks. The system ultimately collects the radon gas from underneath your foundation and will vent it to the outside of your home. If you need to have a radon mitigation system installed, it's best to contract with a certified radon mitigation professional to do that installation. And again, the certified professionals can be obtained, that list, by contacting your state radon program. Now, let's suppose you're building a new home. You can ask your contractor to install radon resistant features. Those can include gravel and plastic sheeting below the foundation, along with proper sealing of cracks and installation of the vent pipe. Once these radon resistant features have been installed and the home is completely built, you still want to perform a radon test because those levels could still be elevated. If the radon levels are still high, a radon fan could actually be added to your system to help you pull those radon levels down. So there are options available to you. These radon systems work great and they prevent lung cancer. So today, as we enter into the panelist section of today's webinar, we are joined by Chad Robinson, and he is the president of Building Performance Company. So we'd like to thank Chad for joining us this evening. He's here on behalf of ARST and is a radon program member at Kansas State University. So thank you, Chad, for joining us this evening.
Yeah, thank you. And I'm not sure why it says Kansas State University member. I'm actually actually the lead radon program trainer at Kansas State.
Oh, okay.
So yeah. Anyway, not sure where the member came from, but
Oh, okay. So we have some questions that have come in ahead of time to help us with sort of driving the conversations and sharing some really important information with folks. First off, what do you do if you have high levels of radon? You know, ultimately, how do you mitigate it, and what does it cost on average to fix the problem?
yeah. So you've kind of already answered the first question, and I teach a 24-hour class on this, so I could go on forever about how we fix radon problems, right? But the basics are we just take the soil gases that are under the house and we give them a path of least resistance to go out of the house rather than to come into the house. And we do that by connecting. So if it's a simple basement, connecting the pipe to the subslab, like drill a hole through the concrete in the slab. If it's an older house, if there's drain tile in the house, we'll connect to that drain tile because that gives us a nice, easy pathway to move the soil gases through there. And if there's a crawl space, one of the questions might be, if we have a crawl space foundation, can we have a radon problem? And the answer is yeah, absolutely you can.
Okay.
And we put a membrane down in that crawl space, seal it up to the walls and piers, and then create suction underneath that membrane and ventilate that to the outside. And also slab on grade. If your house does not have a basement, doesn't have a crawl space, just slab right on the dirt level, you can still have a radon problem. And we take care of it the same way as we would in a basement. And
Okay. So what about like a rental property or an apartment building? Does that change how you would approach it?
yes, to some degree. Um, first of all, there's I didn't answer your other question about costs, and I'll do that
Oh, yeah.
really quickly. I think nationwide, kind of that entry level radon cost is probably for the most simple system out there is $1,200 to $1,500. You might see something less than that, but you're kind of taking some chances on getting it's kind of a get what you pay for thing.
Yeah.
But in a rental situation, the first thing is if you're the tenant, you've done a test, we have to, before we can mitigate that, we have to talk to the owner of the building. Are they going to pay for it? Are you going to pay for it? You have all of that going on. So it becomes a little more complicated in an apartment. Fortunately, there are some national laws. If it's a HUD finance property and they're going to do a renovation, they have to do testing and mitigation if they find high radon levels, and that's everywhere in the country. So that's great news. Fannie Mae and Freddie Mac are also moving towards that on any properties they finance. So that's great news. And I don't think that in the state of Missouri, and I could be wrong about this. I'm not sure what the laws are there, but I don't think there's any specific tenant protections in the state of Missouri. If anybody else knows, that would I'd love to know that.
So are there certain areas within your home that tend to have the highest concentration? Like, is that predictable?
Yeah, mostly predictable. Typically the lowest level, the level that's in contact with the soil, is going to have the highest radon levels. Not because radon's heavier than air, because it just becomes a mixture in the air, just like all the other stuff that's in the air. But because it's closest to the source, which is the soil.
And what about for those people who have a new home and they don't notice any cracks or gaps? Like, should they still be testing their home?
I promise there's still cracks and gaps in the concrete. Number one, anytime you pour concrete that's already cured next to other concrete, we call that a cold joint in the construction industry. There is a pathway from the soil into the house. You can even seal that. I mean, let's say we caulked all the cracks in a basement. We're number one, we're probably not going to actually seal the basement completely. It's really difficult to do that. Second thing is the radon concentrations in the soil tend to build up under the house. So if they can't come in real easily, they build up, and wherever they can still come in, we still have like sealing just by itself typically doesn't do a good job of reducing radon concentrations. So we almost always have to activate a system or have some sort of ventilation under the slab in order to reduce radon levels. So all homes should be tested. It doesn't matter if they're old or new, it doesn't matter what type of foundation they have, they should all be tested.
Okay, awesome. Thank you so much. We will have the Q&A feature too. So if you think of any other questions you have for Chad, we will have some time at the very end to go back for the panel discussion. Thank you so much. So our next speaker is Heidi Naufman-Anda. Heidi is the co-founder of the White Ribbon Project, which is an organization dedicated to promoting awareness about lung cancer by changing public perception of the disease. Heidi is a lung cancer survivor and was diagnosed with stage 3A non-small cell lung cancer in October of 2018. She seeks to encourage other lung cancer survivors and advocates to mobilize efforts to increase awareness about lung cancer and change public perception of the disease. She seeks to work to help improve prevention, early detection, and treatment of lung cancer. So thank you so much, Heidi, for joining us this evening. Okay, so we have a few questions from Heidi that were submitted earlier. Just to get started off, if you could recap, how were you impacted by radon? Oh, I think we may be having trouble hearing Heidi here.
Can you hear me now?
Oh, there you are. Okay, perfect.
What happened there? Yeah, sorry.
No problem.
Yeah, so being a lifelong health enthusiast, health educator, and a fitness trainer, living a very clean life, married to a primary care physician, my family and I were just shocked and blindsided by my stage 3A diagnosis of lung cancer a little over 5 years ago. And the really scary thing about this was I had no symptoms whatsoever, no respiratory symptoms. I went in for, another health issue where a CT scan was ordered for chest, abdomen, and pelvis. And what came back was, well, the thing we were looking for isn't there, but you've got a mass in the upper left lobe of your lung and some swollen lymph nodes in the middle of your chest, and you're inoperable. And I was given a death sentence of 4 to 6 months to live. Luckily, there was a new immunotherapy that had recently been FDA approved. So after chemo, radiation, a pretty aggressive course of that, I had the immunotherapy, and I sit here today, 5 years out, no evidence of disease. But when we had to tell our 3 adult children who lived in this house without ever having fast food or anything, and exercising, how did mom end up with lung cancer? Our oldest child, the 35 years old, him, who is an environmental engineer, asked mom, "What's the radon level of the house?" And I had no idea what he was talking about. And the first thing I was concerned about were my kids, because they spent a lot of time in the basement growing up, and I was down there occasionally to pick it up. But 2 years before my diagnosis, we changed that to we were empty nesters, and we changed the basement to like a cardio gym space. And I was down there every day on my elliptical for at least an hour, huffing and puffing and sweating. And then 2 years later, I have advanced stage lung cancer. So we, after our son educated us about the radon, we had it tested and we sat at an 8. We had been in the house for, at that period of time, for about 20 years. And I was looking at your chart, like 10 picocuries is the equivalent of a pack a day. So, technically, that person should qualify for screening, and they don't. So that's something to ask our doctors, our ACR, the American Cancer Society, insurance, companies, that, what about that fact? So, this was a devastating diagnosis. And again, I'm very lucky to be here today, but it has, a tremendous effect on me and my family. It's traumatizing. Although I'm doing well, I could always come back. And in fact, I'm sitting at the home of a friend in Kansas City right now who was doing as well as I was. And a few weeks ago, this thing went wild and it's back. And, she's terminal. So, we just came out to see her and support her. Part of what we do with the White Ribbon Project, but spread awareness. So, test your home. It is a fraction of the cost of, and mitigating it is a small fraction of the cost of lung cancer treatment and the aftermath. I mean, my care, I never spent one day overnight in a hospital. It was based on infusions of chemotherapy, radiation treatments, and then infusions of immunotherapy over the course of 15 months was $750,000.
Wow.
So test your home. It's good return on investment.
So why do you think it is that there's so little awareness of this danger in our homes? Like,
Well,
do you think there's something we should be doing to fix this?
Well, first of all, I think that there's a huge lack of awareness about lung cancer in general.
Mhm.
Anybody, and the truth is anybody can get lung cancer, whether it's cigarettes, radon. I mean, there's so much that has not been studied. Pollution. They're looking at hormones in women now. We just don't know. And if you're not talking about lung cancer, you're not talking about those risk factors, are you? So there needs to be like a big public health campaign about radon for people to know. And I was recently on a call with a cancer center director, and he said, maybe they need to change the name of the campaign, like instead of radon awareness, because people don't really know what that is, call it radioactive. How
Yeah.
radioactive substance could be in your home, a silent killer. I mean, something to really get people's attention. So I don't think that we're ever going to get that unless we have some major like news stories, public awareness. The CDC, I'm sorry, they should be doing more loud type of, campaigning versus, some social media toolkits. We need more than that.
Mhm. Yeah, one of the questions was actually how has the Missouri Lung Cancer Coalition, can we work with ACS or ACR to make changes to the low dose CT criteria that include exposure to radon levels, or just people with other risk factors? Or, why is it limited to only smokers who can get low dose CT covered by their insurance?
Well, they don't even know about it because,
Yeah.
less than 6% of people who are eligible for the screening who have smoked the 20-pack years don't even know about it, and their doctors shame on them that they're not informed enough to either make the referral or don't care enough. We've run into a lot of physician nihilism through this. And, basically, I'm a health educator. I worked with the AIDS community in the early 90s. If they don't hear the patient demand, the survivors, the caregivers, there's the public outcry, it's going to keep quiet. And so until the public understands that this is a major health crisis, it's a problem, no one's going to care. So, this is a grassroots movement, and the White Ribbon Project has brought a lot of awareness, and it's helping in areas, getting billboards up here in Kansas. We have some in rural communities, but it's totally grassroots. So no one should ever underestimate the power of their one voice. And we got to keep writing letters to the editor, op-eds. We did that. I'm from Colorado. We did that last year. We got that in there, and we were able to basically salvage a low-income radon mitigation act that was it was funded at $400,000 for years. They were going to pull the plug on it. We were asked to testify. We got some other survivors, younger survivors, who really, it makes people concerned when they see very young families who are affected by lung cancer. And we found out about 2 weeks later that not only did they retain the program, but it's now funded at $1.2 million. They
Wow.
saw the return, when they heard my price tag for that's one cancer case, in stage 3, it's worth the investment. So, I think it's an unnecessary risk for people to take. It's, affordable to get your home tested. If it isn't, you can get the free kit. If, at least in Colorado, if you can't afford mitigation, there is assistance out there. No reason to take this type of a risk.
Yeah, and that's really the gap that the Lung Cancer Coalition seeks to serve. And the Missouri Cancer Consortium as a whole, we want to take information that our fellow Missourians are telling us and try to apply that to changing the rules and the policies that are in place to give everyone access to screening and mitigation and just information, really.
Exactly. And think about AIDS. I mean, in the beginning, nobody cared about this disease. And then when it was like, whoa, anyone could get this, there was such public outcry and movements and so forth. And now it's the number one, well, before COVID, it was the number one funded infectious disease by the NIH. Voices matter, stories matter. And I'm so grateful for the opportunity tonight and for showcasing, other survivors tonight as well. And we got to keep going. This teamwork will change it.
Yeah. Oh, thank you so much for telling your story. And I do hope that really drove home the point and the importance of testing for everyone here on the call today. Thank you so much.
Thank you.
Okay, our next speaker is Jackie. Jackie Nixon. She is the Director of Marketing and Communications for Citizens for Radioactive Radon Reduction. She is the publisher of CR3 News Magazine and a stage 1 lung cancer survivor. She's also the Pennsylvania State Representative for Citizens for Radioactive Radon Reduction, which is an advocacy group committed to educating communities about radon and its lung cancer effects. As a stage 1 lung cancer survivor, she was a never smoker, diagnosed by accident in 2015 with no symptoms. And that led her to eventually find high levels of radon in her building and to understand that radon is the #1 cause of lung cancer among never smokers like herself. That revelation was really the pivot point for her joining CR3 and creating and marketing the publication CR3 News Magazine. Her goal is to get the word out, and her publication is now currently read in the US, Canada, Europe, Africa, and Asia. So thank you so much, Jackie, for joining us this evening.
Thank you so much. I appreciate you guys having me on to tell my story 100 million times more, but I always feel like there's somebody that didn't hear it. Okay, so there's something I really want to point out in the beginning this time. I never get a chance to really do this at the end, so I'm going to do it at the beginning. There's 3 takeaways I want you to pay attention to. Number 1, manage your health care. And this kind of segues based on what Heidi just said. You've got to manage your own health care, and I'll explain in a minute. Then the next one is know your numbers. All right, when it comes to radon testing, know your numbers. And then the third one would be there's always something that you can do. Never feel that that oh my God, I'm going to die, there's nothing else I can do. And you've got to stay on that mindset. There's something I can do about this. So what happened to me was, and we'll talk about the manager healthcare to start. I went into the doctor's office. I had shingles, and she gave me the Valtrex for the shingles and whatnot. I was 67 at the time, and she said, well, since we haven't seen you in 18 months, I never got sick. I never had the flu in my life. I didn't even get COVID. I have what they call a super immune system. So I didn't see a doctor, but like every 2 years, only when I cut myself or something like that. So anyway, she said, you get to complain about 2 things every year on Medicare, and they'll check it out for free. It kind of starts your record for the year. And I said, well, there's nothing wrong with me. I'm fine. I was doing my thing, working, and I had absolutely nothing wrong with me. I said, but I sing. And I said, sing 6 months. No, keep trying and trying, but I can't do it. I don't know why. But I said, that's okay. That's just me sitting on my behind in front of a computer all day. So I need to exercise my diaphragm. Now, the most dangerous thing in the world to me is a person who thinks they know all about their health without really doing anything to manage their health. And that was me. I was one of those people that was so confident that I knew everything that I needed to know. All right. So what she did was she listened to my heart, all those good things, and she said, you're clear. And at the very last minute, she had her hand on the door, and she and I were both going to blow it off. And I remember her saying in the consult, you remember that we were both going to blow it off at that point. And she was. And at the very last second, she said, well, let's just get an x-ray, because you get something for free anyway. And I thought, sure, go ahead. You're not going to find anything, right? 2 days later, after that x-ray, they found a tumor on the upper left lobe of my lung. And I had to have a lobectomy. They had to remove the whole upper left lobe. So I was in the hospital for 3 days, and then I was home. Now, I remember in the consult, the doctor saying to me, once they did all the tests, I aced every test 200% because I was a runner. I used to lift weights. I did all these, things, ate right, did all these things. He sat down and he said to me, first words out of his mouth, so how do you think you got this? And I'm thinking to myself, I don't know. You're the doctor. You're supposed to tell me. So that always played on my mind, even to this day. So after that, the lobectomy, I went home. I was home for 7 months. And in that 7-month time, I went back to a board meeting and I was telling everyone about, that I was doing great and they were welcoming me back. And I said, but the doctor didn't seem to know why I got this. And I was talking to a home inspector that was at this board meeting. And he said the magic words to me, which were, did you ever hear of radon? And I said, no, what's that? And so he explained it to me. And I can't really explain it to you, but in my head, calculating how long I lived in the area that I lived in the home that I lived in, and my health and all those things, it calculated out. And I said to myself, that's it. That's got to be one of the reasons. So with that, we used continuous monitors and we did radon tests. I'm in a condo, by the way. And in the condo, directly underneath me, I had my neighbor. We placed one there. And then on the other side of the building, I had my neighbor in the ground, the ground apartments, the garden apartments. Then she tested with a continuous monitor. When they did those tests, and then of course me, I'm on the 3rd floor. When they tested me, I was 3 picocuries per liter. My neighbor directly underneath me, he was 9 picocuries per liter. And the neighbor, Rose, on the other side, she came out to, 18 picocuries per liter. So
Oh my gosh.
then I was so angry about all of this. I was just going to sue. I'm going to sue everybody. So I did call 4 attorneys, and they told me, well, there's nothing you can do because it's perfectly legal in the state of Pennsylvania. That's where I'm at. And I said, what do you mean that there's nothing I can do? My lung is gone. There must be something that I can do. And they said, no, it's perfectly legal. Those words, there's nothing you can do, inflamed me beyond. So I decided in my head, I'm thinking, well, I know what I can do. And that started me on a track, and that's how I fell into CR3. at that point. So again, recapping, what I wanted to leave you with is managing your health. I did not see a doctor for 18 months. Now, can you imagine what would have happened if we both blew that off and I never got sick and I had this tumor on the outside of my lung? Within another year, it could have been much, much worse, or I could have died, right? Learn to manage your health on a regular basis. I had no symptoms. So don't think because you might have a neck pain or back pain or something like that, oh, it's just this, you know, find out, go see your doctor and take care of, you know, whatever those things are. Make sure you know. Number
Yeah,
two,
Heidi echoed those same points, you know, being
Did he?
proactive about your health, but also being proactive about your environment.
Thank you.
You know, those
Yes.
are, you have a right to
that.
advocate for yourself, and sometimes we have to. So
Yeah.
thank you so, so much for
You're
telling your
welcome.
story. I do think it really drives home the importance of, you know, knowing what your rights are, and that education piece, you know, just making others aware of the risk and what they can do about it.
Okay.
And we will I'm sure we'll get some more questions for you here in the Q&A session too. Okay, thank you so much.
Oh, you're welcome.
Okay, and our next speaker is Dr. Vipul Banderi. He is a board certified hematologist and medical oncologist with experience in lung cancer and is currently faculty in the hematology oncology department at the University of Missouri School of Medicine. He graduated from the Ross School of Medicine in Edison, New Jersey in 2006, and before joining the University of Missouri last year, Dr. Banderi was the oncology medical director at Louisiana State University's Health Science Center. So thank you so much again, Dr. Banderi, for joining us this evening.
Sarah, thank you. And actually, a special thank you to both Heidi and Jackie for sharing their story, and also some of the special points that made out in terms of not only the radon levels, but, you know, following your health. And back to what Jackie was saying as far as not having symptoms, and linking that back to what you were talking about originally as far as the overall outcomes with earlier detection. So when you have those earlier stage cancers, which is the whole purpose of the lung cancer screening, that actually that earlier detection provides for better outcomes because you're able to resect it out. Linking that back with what Jackie was saying, a lot of times, especially with lung cancers, when you're early on that stage one, maybe, you know, 1B, and some of the stage twos, a lot of times they're not symptoms.
Mm-hmm.
And of course, that's the whole purpose of having the screening there. And as far as the levels there and the risk of getting lung cancers from radon, as your radon level increases from 2 to 4 to 8 to 10, your lifetime risk of getting lung cancer starts going up significantly. And it's similar to when you have other environmental exposures, like asbestos is the most common one that most people think about outside of smoking. And of course, if you look at statistics, it's actually radon is number 2 right there, in terms of likelihood of getting the cancer from an exposure. And then, you know, if you go number-wise, there, smoking, radon, secondhand smoking, and then you get the rest of your environmental exposures like the asbestos, fumes, air pollution from motor vehicles. So it's, again, back to what Heidi was saying, in terms of when you go to see your primary, now, of course, most of the patients we see, of course, they're already diagnosed and at the time. But if you talk about decreasing the risk, catching things early, and the primary health and primary prevention, it goes back to decreasing the radon levels, whether it's in the house, whether it's at workplace, and then of course most people spend a significant amount of time in their homes or wherever they live. So that when we talk about length of exposure or duration of exposure, those levels start becoming more significant. And so, if you're at that, if you look at the EPA recommendations and you're at that, above that 2 and at that 4, where there's that cutoff of the risk starts going up significantly. If you look at that lifetime risk, it's a little bit higher than getting into a car crash.
Mhm.
And so, you're talking about multiple fold risks there. And again, back to what you're saying is, well, if you're smoking on top of that, and that's going to multiply by almost tenfold.
Mhm. And you made a good point about the asbestos. We all know asbestos causes cancer. Why do you think it is that there's this lack of awareness about the dangers of radon? Like, is there something else that we should be doing? How do we all know about asbestos, but we don't know about radon?
So, the asbestos, of course, it's made news for a lot of different reasons, and one of it's from the it's in the buildings, it's environmental, it's something that's placed for the most part as insulation, or people are working in certain industries that they get more exposure to it. But radon, it's more natural. It seeps out of the ground as a part of that radioactive decay, and there's just not been that much public emphasis, whether whether you talk about newspapers, TV journalism, the CDC, even though there's of course significant amount of data as far as risks, and then the second part of that is the testing.
Yeah.
There's not that many percentage-wise, if you look at how many people get their homes tested for radon, whether if they're buying, because a lot of times if you look, people will talk about getting their homes tested for mold or whatever else, when they're buying. There's not really much emphasis that's been placed, at least from what I see in terms of from public health officials at the national level, and the industry, and of course we're more at the state level trying to address this, and I believe the test kits, they're actually coming from the state, correct?
Yes.
Um,
And that's a good place. We can actually start it. I'm going to go ahead and stop sharing my screen so we can start inviting some of the other panelists to kind of join the conversation. And that way we can see everybody, hopefully. So there have been a few different questions that have popped up in the chat, but one of them actually came from Heidi, and I had the identical thinking. Why is it, like from Jackie's story, why do we think someone would ask you, how do you think you got this? If you have breast cancer, no one asks you, how did you get this? If you have colon cancer, no one asks you, how did you get this? There's this blame that's sort of superimposed on lung cancer specifically. And why do you think that is? And do you think that we can get past that? Like, what should we as a coalition be doing?
So there's several things. Again, I think that goes back to what Heidi and Jackie they were talking about, is the most obvious cause, of course, is smoking. But once you get beyond that, when you have that diagnosis of lung cancer, you don't have a history of smoking. Very few people have actually ever tested their home for radon. in terms of exposure. And for other things, as far as asbestos, it's from work history and other exposures. Those are fairly easily, if there is an exposure, it's fairly easy for us to get that answer. For radon, and the same thing goes for other secondhand, other environmental exposures, as far as the volatile organic compounds and air pollution. Even if you look at a lot of the more densely populated cities across the world, actually, in some of those places, there is a large percentage of people who are newly diagnosed with lung cancer that actually have no history of smoking at all.
Mhm.
And so, and those numbers are, in fact, percentages are dramatically higher than what we have here in terms of not people who are non-smokers that end up that get diagnosed with lung cancer.
Yeah, yeah. No, that it definitely, it seems like it's one of those topic areas that I think we all assume lung cancer equals smoking, and I think we need to kind of get out of that mindset collectively. I know in the chat we had one question about the timing for testing, and so this might be more of a question for Chad. How frequently do you recommend testing in your home? And does that change if you have like a history of radon being high in your home? Should you test more or less frequently?
So I'm not a doctor, so don't take this as medical advice,
Mhm.
but if I had a history of lung cancer in my family, I would have a continuous monitor. There are some really great consumer grade continuous monitors available now where you can keep track of what your radon level is all the time. And if you're really concerned about what your radon level is, there's no reason not to have one of those. It's less expensive than having a professional test done in most locations across the country. The problem with those consumer grade continuous monitors is, number one, they're not certified by any organization. They don't have to be calibrated or anything like that. So it's really a good idea to do a cross check with a charcoal test kit or one of the free test kits or something like that. But it's those things, they become so inexpensive, and they're really great, and they can give you tons of data, and I'm a data guy, so I'm always going to say more data is always better. But just and to go back to the original question, the EPA says if you have a test that comes back high, you should retest every 2 years, even if you have a mitigation system in place.
Okay.
So at least every 2 years. But if you're really concerned, get one of those continuous monitors. They start at like $110. So
Yeah, another question that came in was about sort of the disclosure, like what does that mean? And I think most of us associate radon testing with buying a house. So do we know if you're legally required to disclose that you have high radon when you go to sell your house?
again, I'm not a lawyer in the state of Missouri, so I don't know all the real estate laws there. In the state of Kansas, where I'm from, it is a requirement. You are legally required to disclose if you have high radon levels. In the state of Kansas and in several other states across the country, there are awareness laws where in all real estate contracts, there's a requirement to say that radon's a problem in that given state. And hopefully Missouri gets that kind of a law as well, but it does drive a lot of awareness in those states, because every time somebody buys a house, their real estate agent is required to say, there's this part of this contract that says radon's a problem in the state, you should test. So that's not the case in Missouri right now, but hopefully it will be someday.
Chad, just as a follow-up to what Sarah was saying, and as far as that's if they tested or Is there any mandate in terms of when there is a purchase, when someone's buying a house, that there's a mandate that states, well, Missouri has 1 in 3 houses has high radon level. Yeah, I think that was the number. And because it's 1 in 3, we require all real estate transactions to have a radon testing prior to the transaction.
No, there unfortunately there's not. There's one county in the state of Maryland that requires radon testing during real estate transactions. As far as I know, that's the only place in the country that requires radon testing on single family residential homes. The HUD financed multifamily properties are the only other place where there's a requirement to test 100% of or at least 100% of ground contact units in those properties. But single family residential, there's no requirement to test, there's no requirement to fix at the national or state levels. There can be a requirement by mortgage companies or something like that, but it's almost completely consumer driven at this point as far as single family residential goes.
But if we're saying it's such a high risk, is that something from, say, from the Missouri Cancer Prevention Program? Is that something that is maybe that should be addressed at the state or the legislature level, given you know, if we have 33% of the housing at risk, in terms of having that as part of any transaction, because that would certainly, at least that would bring more awareness to this than most of the things that you know, certainly most of the other things that we talk about here, yeah, as far as, because every time someone buys or sells a house, of course it would bring it up to the attention. Not only that, the levels come back high, now you can fix it before someone moves in.
Yeah, yeah.
We would love to see that happen. From a risk management perspective, it's just a matter of getting everybody on board with that. The legislature, anybody who might oppose it because it's makes a home sale more difficult or something like that. So getting a law like that to pass has not been accomplished in the nation yet. I'm not saying Missouri shouldn't go for it, but yeah, that would be great. That would be the gold standard for radon, is to have every house tested every time it's sold.
Well, until we get there, we have the QR code here that you can scan to get your free test, and tell your neighbors, tell your family, tell your friends, you know, tell everyone who will listen. You know, the best piece of information you can have and the most proactive you can be about this is to know what the level is within your own home. So hopefully everyone has learned quite a bit from our panel. We had just amazing speakers and a good cross section of different perspectives to really drive home these points. So we want to thank everybody. We will be sending out additional information via email so that you can order your own test kit. And we will have the recording available after the webinar today. But thank you again to all of our amazing panelists and for sharing your stories and sharing your expertise with us this evening. Okay, we will hopefully see everyone at another upcoming webinar here, and don't forget to get your test.